For the last 70 years, doctors have recommended aspirin to prevent heart disease. But now there are new guidelines about whether it's doing more harm than good. And Verify viewer Charles asked us to help clear things up. So Charles, let's verify. Is taking low-dose aspirin daily to prevent heart disease recommended? Our sources are the U.S. Preventative Services Task Force, the American College of Cardiology, the president of the American Heart Association, and a cardiologist at Virginia Commonwealth University Health. The question started after the Preventative Services Task Force proposed new guidelines this month suggesting most adults should not start taking aspirin to prevent heart disease. Previously, it recommended daily aspirin for high-risk adults over 50. The American Heart Association points out this change just backs up what it recommended 2 years ago.
We're pulling way back on the recommendations for who needs aspirin. So this really means that millions of people who previously might have been recommended for aspirin now probably should not be taking it.
There are two main reasons for the new guidelines. One is how aspirin affects the body. It's a blood thinner, and new research shows not only does it have only a small impact on preventing first heart attacks, but it also puts patients at a greater risk of major bleeding. The other is that newer medicines can do a better job at treating the causes of first heart attacks, especially in younger patients.
For example, make sure your blood pressure is controlled. Make sure your cholesterol is controlled. If you're smoking, stop. And those are all much more likely to offer benefit with less overall risk than taking aspirin would be.
So it's false that low-dose aspirin is recommended to prevent heart disease for most adults. The new guidelines don't apply to adults who already have heart disease or were already prescribed a daily aspirin. And as always, talk with your doctor before making any changes. With your Verify, I'm Brandon Lewis.
If you have something you want us to look into, email verify@whas11.com or message us on Facebook or Twitter.